Aibowan, and a very good evening to all our viewers here on TV1. I'm Dr. Dilshan Fernando, and this is your weekly dose of wellness here on Healthline. I would like to also present a warm welcome to all our viewers watching on YouTube, especially from Australia and UK as well. Today, we are going to venture into a territory that we haven't ventured before here on Healthline. Today, we will be talking about a topic in gynecology. It's a very common and prevalent condition that is experienced by many young females in the reproductive age. And our topic of discussion for today is none other than PCOS or Polycystic Ovarian Syndrome. So, today to talk about this topic, we have invited Dr. Indunil Piyadigama. He is a consultant gynecologist and obstetrician. A very good evening to you, sir, and thank you very much for joining us here on Healthline.
Good evening. Yeah.
So, PCOS is a commonly discussed topic, but just for the benefit of our viewers, sir, if you can give us a very brief description as to what PCOS is, I think that would be a good introduction to our program today.
PCOS, Dilshan, PCOS is basically in the long term we call it Polycystic Ovarian Syndrome. This is basically a problem with the androgen production in the ovaries. So, what do you mean by androgen is it's a male hormone. So, there's excessive male hormones produced by the ovaries. So, now people may wonder what polycystic ovary and this androgen, what is the link between them. So, basically a polycystic ovary is a entity where we can see on an ultrasound scan where there are a lot of cysts, that means fluid filled multiple spaces inside or within an ovary. That is what we call a polycystic ovary, but that doesn't necessarily means that a person is having polycystic ovarian syndrome. Some people may have polycystic ovaries but not have the syndrome, while others will have the polycystic ovary with the syndrome. So, as a whole, polycystic ovarian syndrome is a collection of, I would say, symptoms and signs with some of these ultrasound features that present in a way where the woman will present with problems with menstruation, excessive hair, maybe acne, and problems with the fertility and some long-term effects as well.
So, I think that's a good introduction to our topic today. So, polycystic ovarian syndrome, so basically an ovary with multiple cysts and also a collection of signs and symptoms. So, I said it's a very common condition, sir, but how common is it really?
Yeah, it's a very variable thing where it depends on the region that you're talking about. So, in general, in some of the literature it says it goes up from about 5% up to about 15 to 25% even. But what we know from around our part of the world, especially South Asians, the prevalence is very high. Even in some of the studies that says like the prevalence is up to about 50%. That means like out of 2 women, 1 will be having polycystic ovarian syndrome.
So, that is a very high prevalence, especially since we are part of this South Asian population. According to Dr. Indunil Piyadigama, it can be prevalent as high as 50%. So, I am sure all our female viewership would find it very beneficial to continue listening to this program, because we will be going in depth talking about signs and symptoms and the far reaching effects of polycystic ovarian syndrome. Now, we know that this is something related to the female menstrual cycle. So, let us talk a bit about the normal menstrual cycle, and then can we elaborate on what happens to the menstrual cycle in these patients who have PCOS?
So, normally a menstrual cycle is something that we call that a woman will have monthly bleeds. But how does it actually happen? There's a lot of interactions going within the body to make it happen in that way. So what I'd say is, so basically the brain, or what we say the pituitary, has to produce certain hormones, like we call it LH, FSH, which act on the ovary itself, and then from there it produces estrogen and progesterone. So there's a fine balance between these hormones. So the brain and the ovary functions together in a very organized manner in producing these menstrual cycles. So this, if we take these hormones that comes from the pituitary, we call it FSH, acts on the ovary, and there are multiple small cysts, or the eggs in the ovary, which are there from the before the birth of a woman. So one of these eggs get the signal to become a mature egg, which can potentially have a pregnancy. So it gradually develops and become a mature egg, and then from this it secretes a lot of estrogens. And when it comes to middle of the cycle, we say if it is a 28-day cycle, on the 14th day this mature cyst will produce an egg. So this shifts the woman's hormonal profile from predominantly estrogen to a progesterone high status. So what happens is, now with the estrogen, the other thing that happens is inside the lining of the womb gradually develops. Why is it developing? Because if there's a pregnancy, it needs to accommodate inside the womb. So there has to be good environment for a baby to grow. So basically the endometrium develops little by little, but when the progesterone comes into play, it can't sustain this development. So because of that, gradually it gets deteriorated, and then but manifest as a monthly bleed. So that's why how a normal cycle works. So why we want to talk about this, Dilshan, is now basically in polycystic ovarian syndrome, this disrupts. As I said, this is a very fine balance between these hormones. So if the fine balance is not there, then you can't produce an egg, and if there's no egg, there's no monthly bleeds. So that's what basically goes on within the ovary.
Right. Now, you said there are some male hormones produced in the females as well, and these are called androgens.
Yeah.
And also the fine balance that causes the regular menstrual cycle gets turned off.
Yeah.
So with these changes, there can be so many manifestations that we see as signs and symptoms.
Yeah.
So if you can elaborate on what kind of signs and symptoms that these patients might have, then our viewers will be benefited. If they do have some of these signs and symptoms, if they are confused as to what's going on, they might be able to correlate this and seek proper medical attention for the signs and symptoms that they are having.
So basically, as I've explained, the basis of this is there's no ovulation, so that is there's no production of an egg. So that means most of the women will either have missed periods or irregular periods, or they might bleed only a very little when it comes to their periods. Some of them might have periods very regularly, so that, like, in the sense you get one period maybe in January and the next one will come in about March or April. So what happens is, if the periods are that long, then they will actually bleed quite a lot during the period, and can even present with what we call anemic symptoms, or low levels of blood iron. So those are the problems related to the periods. Then other than for that, as I said, polycystic ovarian syndrome is a problem with the male hormones, or like excessive production of male hormones. So what happens, the women will present with having excessive acne, or they might have oily skin, which is not a desired effect, like it's mainly towards the male side, isn't it? Then some of them start to have hair growth. hair growth in the sense
the male pattern.
Yeah, male pattern hair growth in the sense you get hair on the chest, abdomen, or even on the back, and some of them might even get loss of hair, like males. So we call it the male type baldness. The female supposed to have the forehead covered with the hair, but the hairline regresses back, and it becomes more like a male type of a appearance. And some other things may be that they might develop small skin tags on the neck or even the armpits, and some may develop some discoloration over the neck, then armpits or below their breasts. So those are the manifestation that you will see from outside. But apart from that, the other group of women with this condition, like, is a large group of women present with problems with fertility. So they are trying to conceive, but they cannot because of these effects of this disease. So now those are the immediate sort of problems that might occur with polycystic ovarian syndrome. But it doesn't stop there. Like, if it is not sorted, long term also, people can have problems. Like,
yeah, let's get on to that as we progress with the discussion. So now, irregular or missed periods, then male pattern hair growth, then also leading to severe effects like subfertility as well. PCOS is a very far-reaching condition. Now, is there some genetic predisposition, or is this a condition that runs in the family?
Okay, it's a very good question, and this is something that is, for even the health professionals, it's a bit of a difficult question to answer, but definitely it runs in the families. So PCOS has some genetic predisposition. Why I say that is, if the mother, the sisters have the problem, the daughter is also likely to have the same condition. So we call it the autosomal dominant pattern of inheritance. That means each and every female member of the family might come with the effects of the disease. But having said that, this is not the only reason for developing polycystic ovarian syndrome. So the environment also has a major role to play. So if I try to explain a little bit more, now these are all hypothetical ones because
not yet scientifically proven.
Yes, in a way it's half proven, but I wouldn't say that it's completely 100% okay. Like this. So there may be two types of women with polycystic ovarian syndrome: obese type or the slim type. Now, if we first take the obese type, what happens in this sort of a person is they have an inherent problem with insulin resistance in their body. What is insulin? Insulin is the hormone that is used for glucose control. But what do you mean by insulin resistance? Insulin resistance is where insulin is secreted in the body more and more, but the insulin cannot control the glucose levels in the body.
So basically what happens in diabetes.
It's basically like something happens in the diabetes. But so therefore, because the body cannot insulin levels cannot compensate the glucose surge in the body, more and more insulin is secreted in the body. This insulin works as a sort of another hormone that really acts on the body to deposit fat. So therefore, more and more fat is deposited in the body, especially around the belly area, so that the BMI is increased basically. So what happens in this fat tissue is the fat converts a woman's body estrogens into androgens. So estrogen is the female hormone that we talk about, which brings about all the female qualities, isn't it? So androgen is a male hormone, like the real name is testosterone, so which has the male type of qualities. More the fat you have, there's more conversion of estrogen into
testosterone.
So ultimately there will be more and more testosterone, so that disrupt the normal pattern of this fine balance between the brain and the ovary of producing the hormones. So this is one type.
That's the obese type that
obese
you
type,
described.
Yes. Yeah. Then if we go into the slim type, so it may be a problem within the ovary itself that the ovary produces excessive amounts of androgens. So generally anybody, like even all females, they have a certain amount of androgen production from their ovary. But what happens in the PCOS slim ladies, because of the brain secreted LH hormone that acts on the ovary, and there it's produce excessive amounts of androgens. Again, the whole fine balance
cycle breaks down,
disrupted, and then you get multiple tiny cysts here and there, and then you get all these manifestations of excessive body hair. So those are the kind of two ways of explaining this. But other than for that, just keep apart this slim obese type or anything. Anybody who is not even prone to polycystic ovarian syndrome is obese or put on weight, then they are prone to developing all these things, and then the cycle disruption and having this syndrome.
So because the fat will work as an organ which converts estrogen into these androgens, and all these manifestations will occur in them as well. So now we spoke about how this comes into being. Let us talk a bit about how we diagnose this condition. It may be that you can see these manifestations from outside, but what would be the investigations that you would employ as a consultant gynecologist to come to a definitive diagnosis, to say, okay, this female has polycystic ovarian syndrome?
So basically, diagnosing this needs a consultation with the woman, and one thing is based on the symptoms or the medical history. So you would want to know what sort of problems that is associated currently. Then we might also need to do a physical examination, especially internal examination, to look for the female reproductive organs if there's any problems within them. So also, other than for the internal examination, you might also need an external examination to find out these manifestations, what sort of things are there, because it's very important where you collect all this information so that you can give a better way of managing. So other than for this, it's very important that the woman undergo an ultrasound scan. Generally, this is an internal scan where you look for the ovaries. What we are trying to look for is the size of the ovary or the volume of it, and also the how it appears. Typically, the polycystic ovaries, we call it, it's a ring of pearls appearance where you get multiple tiny cysts surrounding the ovary, which is not the case in a normal female, because normal female will have a dominant follicle within their ovaries. Then at the same time, when we are doing a scan, we can also see the womb and the lining of the womb, thickness of it, and all these things will help. Other than for that, some people might need some blood investigations. These include the male hormone levels, androgen levels, as well as the carrier proteins of male androgen levels. So collectively, from all these things like the symptoms, signs, and then the ultrasound findings and the blood investigations, we would be able to come to a diagnosis. If somebody with a better medical knowledge listening to them, we use a criteria called Rotterdam criteria, which is the widely accepted one that we use for diagnosis of this condition. Now, other than for this, it's very important to do assessment of the blood sugars and as well as the cholesterol levels, the triglycerides and the LDL levels, to check the baseline and how the woman's metabolic profile is.
Now, let's say a patient presents to you with one or many of these symptoms, and you have diagnosed this patient to have polycystic ovarian syndrome. What would be the considerations moving forward with the treatment? Because we know we discussed multiple manifestations and most of these patients won't have all of them. So, I believe the treatment would have to cater to each individual's what they are having. So, what would be your treatment considerations and what are the modalities of treatment that are available for them?
So, this is a very big topic to discuss basically. How we decide on treatment for a particular person depends on the problem that they are having, or the age of the person, or then it also will depend on their wishes for a fertility or the pregnancy in the future. Now, if I take one by one, now we'll take somebody, the main complaint that they are having is they are not having regular menstruation, or they are skipping menstruation, or heavy bleeding. So, the problems with having problems with menstrual pattern. For these people, what we recommend is using oral contraceptive pills. Now, how does oral contraceptive pills act? Is basically, as I said, to a woman to have a proper menstrual cycle, there's a fine balance between all these hormones. But what we do now with the oral contraceptive pill is we take this control into our hand and we control this woman's level of hormones so that she will have monthly bleeds regularly. Okay. Now there comes a question. Now a lot of people ask us, like from a gynecologist, doctor, do I need to have a period every month? The question that they are worried is, if I don't have a period, what will happen? Will it be harmful for me? So people think that if they don't have a bleed every month, that they will collect a lot of abnormal mediators inside the body, a lot of metabolites, and because of that they will have harmful effects. On the other hand, some think that bleeding is a way of cleansing themselves. So on the other hand, some will think that if they don't bleed, they will put on weight and they will become more and more fat. So those are the concerns that a lot of people have. But for us as a gynecologist, we are not worried about whether they are having monthly periods or not, because you don't need to have monthly periods, because none of these things that all of these are myths. Because
so these are misconceptions held in society. So that's something very important, an important juncture we have reached in our program. As Dr. Indunil was explaining, even if you don't have a regular period every month, it doesn't mean that it's a mode of cleansing yourself or that you will put on more weight. So it's very important that Dr. Indunil is clearing all these misconceptions that are held in society. So moving on with our discussion, sir, you were explaining about the treatment modalities.
But for this, but especially with a woman with PCOS, as doctors, we are worried if they don't have a period in about 6 months' time. So we would like them to have a period at least every 3 months or so. Why am I trying to say this? Because PCOS condition causes a lot of changes in your body hormone profile. So which causes the endometrial lining or the womb lining to grow excessively. So if you don't have a period at least once in every 3 months, the problem with this is the endometrium will, or the womb lining will grow excessively, and ultimately this can lead to endometrial cancer within. So that's the only reason that we want a period to occur, but we don't want it to happen every month, but at least every 3 months if it happens, then we are happy as gynecologists. So that's about the period. So basically, using contraceptive pills, we can sort of negate these problems.
Before we move on to the next modality of treatment, sir, there might be a question arising with this, that people might ask, is it okay to be on long-term oral contraceptive pills? Are there any risks involved with this?
So this is a separate also or a
Yeah, if
big
you can
topic
give a
to
brief answer to
So
that.
generally, if there are no contraindications for the woman, then oral contraceptive pill is a safe method to use, and in fact there are some major advantages of oral contraceptive pills, especially with regards to reducing a woman's risk of cancer, breast cancer, ovarian cancer, as well as the endometrial cancer.
So let's continue with the rest of the treatment modalities.
So now another manifestation is this acne and the excessive hair growth, or we call it hirsutism. So how are we going to tackle this? So for this, there are local treatment as well as treatment that are taken systemically. Now what I mean by local treatment is you do something on the manifestation itself, that is like you have hair, you do something to get rid of it. So there are ways of managing hair like waxing, then there's bleaching, and also there is newer technology which is laser treatment, which has come up that can clear the hair, including the follicles, so that the hair growth is relatively slowed down. Then there are some medications that we can use that will specifically act on hair follicles. So thereby like thins down this hair and then reduces the hair growth. But these medications do not act immediately. Any of the medication which we use systematically, because systemically, the reason behind is hair has a sort of a cycle length. It takes about at least 6 to 9 months for the hair to develop into that level. And so if we are trying to work on the growth of the hair, the actual benefit of it come in about 6 to 9 months time. Then other systemic treatment are like there are some hormonal pills, like even birth control pills can be useful in reducing the body androgen levels. There are specific types of oral contraceptive pills that are coming up in the market now. One thing is that contains cyproterone acetate, which is a specific type which is an anti-androgen. So basically the women's acne will go off, the oily skin will go off, and they will have getting their appearance back to normal. Then there's also something which contains spironolactone. A lot of people call this Yasmin, the pill by the name, that can also reduce the hair growth. These are like specific types of treatment. These are not like to be taken haphazardly or on a long-term basis, but you can take them for a limited time period.
Definitely, that is one thing that I want to reiterate time and time again here on Healthline. Even though we discuss certain types of drugs or medication, this is not for you to decide by yourself, but only by prescription from a properly qualified registered medical practitioner. So now moving on with the treatment modalities, so we discussed about having regular periods, then we discussed about the male pattern hair growth. What are the other modalities available?
So then the next group of people which needs treatment are the people with problems with conceiving, or we call it subfertile or the infertile people. So this is much more challenging compared to what we were talking before, because for you to have a baby or a conception, that means you need to have a egg produced within the ovary. Now, as I discussed earlier, this is a very fine balance. Producing an egg needs the hormones to work in conjunction with each other, so that optimal time that the egg would be released. So therefore, managing infertility is much more challenging compared to these other things. Why I say that is we need to get this process back to normal or reverse the problems that we say are happening. So how can we do this? So basically one thing is by reducing the weight. So weight reduction can have massive impact on the outcome for the patient. Now suppose if the lady is 70 kilos of weight, what we advise is for a 5% weight reduction. So how much would it be? It's about 3.5 kilos.
Yeah.
It's an achievable task. So, but it can't be achieved overnight, but it takes time for someone to lose about 3 to 4 kilos. But if a woman can lose this amount of weight, then what happens is their cycles become regular. All the male type of hormone effects goes down, as well as they start ovulating, where they will be able to have a offspring. Yeah. So this is a very important thing for the polycystic ovarian women. Now, how would somebody reduce the weight? Like even 3 to 4 kilos may be a difficult task for a lot of people. No? So it's basically by changing your lifestyle and diet. How would someone increase their weight is by a balance between their energy intake and the expenditure. If you have more energy intake compared to expenditure, you will keep storing this energy in the form of fat. The body thinks this can be used in the future, and therefore it stores in the form of fat. If you can reduce the energy intake and increase the energy expenditure, then gradually the body will release this excessive amount of energy and the fat tissue will go down. So basically the androgen levels will go down and everything will most likely get back to normal. So this is one way, but we find that some women, it's very hard for them to reduce weight. It's easy to say, but difficult to
actually practice in real life.
So for these people, there are other ways of doing it. So there are some medications that can be used for weight reduction. And for certain people like who are extremely big made, there are even surgical modalities that can reduce their weight.
What we call as bariatric surgeries, gastric bypass and that type of surgeries. So what we are trying to advocate is not a quick fix to lose weight, but if you are having a condition like polycystic ovarian syndrome and you have wishes of fertility, in that aspect to achieve those wishes, there may be some modifications and treatment that we can offer medically for you to lose weight. But ideally speaking, if you are just looking to lose weight without any of these medical conditions, a proper diet, maintaining a calorie deficit, and having an overall healthy lifestyle would be the best way forward. Now, we spoke about these treatment modalities. Now, for a patient with polycystic ovarian syndrome, conceiving itself is a very difficult task. But even after conception, are these patients more prone to develop complications in the pregnancy?
That's a very good point, but is it okay, Dilshan, if I talk a little bit about conception? Because now, so having said all these ways of reducing weight, we still find people which they find it very challenging to change their weight. So for these people, or even like if somebody who reduces the weight and even still unable to conceive, then there are other options for us to use. So there are certain types of medicine that we can use that can artificially provide the micro environment for the egg to mature into a mature follicle. So there are medications which we use like early in the menstrual cycle, so which can produce an egg by day 14, and therefore they would be able to conceive. That is one way, and there are different types of medication that we can use for this purpose. But also these are not to be taken over the counter, because there are complications that can come. Sometimes there can be number of, like rather than just one one mature egg developing, there can be multiple eggs developing, and that can lead to multiple pregnancies, or even a very bad condition called ovarian hyperstimulation syndrome. So therefore, it has to be done carefully. On the other hand, we also can use surgical ways of managing this problem. So we call it, the surgical method is called laparoscopic ovarian drilling. People might have heard about this. Laparoscopy is basically, we use a keyhole method where you insert a tiny camera inside the abdomen or the belly, and you put some gas into the belly, and then you use a light inside so that you can illuminate, and using a video camera you can see what is inside the inside one's body. And in this way we can see the ovaries, and we can reverse the process of higher androgen production within the ovaries by using electrical energy. So where we make small punctures in the ovary, and using the electrical energy we can reduce this abnormal balance within the ovary. So that way also we can increase someone's chances of having a offspring.
So moving on to my questions now, once they do conceive, are they more prone to develop complications in the pregnancy?
Yes, that is a very good thing, because very good question, because it doesn't mean that somehow that you get pregnant will sort out all your problems. Basically, even if you get pregnant with this polycystic ovarian syndrome, because of this male type predominant hormones, they are more prone for miscarriages. And also during the pregnancy, there's higher risk of developing diabetes during the pregnancy. We call it gestational diabetes, where the sugar levels exponentially increase during the pregnancy, which is not good for the baby ultimately. And also they can develop high blood pressure during the pregnancy. So those are the main sort of problems that can affect during the pregnancy. But other than for that, because of these hormonal imbalances, even the babies can become tiny, or the small babies. These small babies are prone to other problems. So likewise, there can be other things happening even if you become pregnant. So what we advise generally is, if you are planning for a pregnancy, it's always better to reduce your weight, because reducing the weight will cause alterations in these abnormal hormone patterns that will have beneficial effects for you even during a pregnancy.
So if you are having PCOS and if you are having wishes of fertility, definitely you will be benefited by seeking proper medical attention. And before conceiving, according to Dr. Indunil Piyadigama, you need to lose weight and prepare yourself, and once you conceive, constant follow up with your obstetrician would definitely be of value. Now we are coming towards the end of the program, sir, with our time restrictions. What are the possible complications of untreated polycystic ovarian syndrome?
So there can be long-term problems with, as we mentioned earlier, with polycystic ovarian syndrome. So basically, a woman is protected from having strokes, heart attacks, because of their hormone profile compared to a male. But this actual beneficial effect is lost because of the polycystic ovarian syndrome. So they are more prone to having cardiovascular problems, they are more prone to having hypertension, then they can have high blood lipid levels, or we call it hypertriglyceridemia or high LDL levels. Then they are more prone to have diabetes. So those are the overall bad manifestations that can occur with PCOS. Other than for that, as I mentioned earlier, PCOS women are more likely to have endometrial cancer because of, again, the manifestation of these effects of the hormones.
So having said that, I'm sure our viewers would understand that if you do have these signs and symptoms, it is very pertinent that you get yourself the proper medical attention so that you can reduce the signs and symptoms, you can treat this condition and also avoid these undesirable long-term effects. Now, as we come towards the end of the program, sir, what would be your take-home message to, especially to our viewers who have been suffering from this condition day in and day out for years at end?
So I would say PCOS is a very common problem in the women of childbearing age, and the main problem is that there are multiple cysts developing within the ovary and imbalance in hormonal production, mainly going towards the androgen production. So because of these hormonal manifestations, women can develop abnormal symptoms like irregular menstruation, excessive hair growth, then acne, and some people may have problems with fertility, and also there are long-term manifestations. The long-term manifestations may be that they have high risk of heart disease, hypertension, or high blood lipid levels, or even endometrial cancer. It's very important that we identify this and then try to manage it accordingly. And the management, there are a lot of options of management, but it depends on the woman's age and also their fertility wishes and what sort of symptoms that they have.
Right. So we had quite an in-depth discussion about PCOS or Polycystic Ovarian Syndrome, and I believe our viewers would have greatly benefited from this discussion. So we thank Dr. Indunil Piyadigama for gracing our studios here this evening. Thank you very much, sir, for joining us. And until we meet you again next week, I would like to thank all our viewers who have been giving so much of valuable feedback. It has greatly helped us in developing our program. And until we meet you again next week with your weekly dose of wellness, this is me, Dr. Dilshan Fernando, wishing all our viewers Aibowan.